time.
Thanks, Lachlan. Minister, Ireland unfortunately has a dark and disturbing history when it comes to the mass institutionalisation of people with mental health problems. And it's only in recent history that the state has begun a broad shift away from this model of care. However, according to the Mental Health Commission in Ireland, the law in its current form is still outdated, outmoded, and is not based on a progressive, rights-based approach to mental health care. Their most recent report highlights this case, revealing a significant governance and management deficits within mental health services. Other concerns include hygiene and maintenance levels, levels of compliance, use of physical restraint in young people, seclusion, as well as 70% of approved centres registered with the Mental Health Commission remain dirty and poorly maintained. On upgrading legislation, it's vital that reforms are brought in soon. Advocates have continued to call for legislation to be published no later than the end of this year. Irish legislation is still without key aspects and does not incorporate specific guiding principles for children under the 2001 Act. Individuals do not yet have a statutory right to individual care or recovery plans. Voluntary patients still do not have basic rights to information or advocacy. And while people aged between 16 and 17 can consent or refuse to physical health care decisions, this does not apply to mental health care decisions. And most poignantly, in the context of this debate, involuntary patients do not have the right to have their advanced wishes about treatment respected, leading to every year between 2,000 and 2,500 people detained against their will in psychiatric facilities where they can be forcibly injected with medication, physically restrained by staff and locked in isolation. It is clear that despite reforms made in recent years, the Irish state still retains a disproportionate amount of power over individuals with mental health issues, and this use of control and coercion must be looked at as a matter of urgency. The Mental Health Commission has repeatedly called for serious attention to be paid to the human rights of mental health service users in terms of capacity and consent to treatment. I believe that the main obstruction to greater reform is the fact that the state funding has been in crisis largely due to decades of chronic underinvestment and the inability to recruit and retain staff providing the care. And if we decide everything on value and on money, well, then we're in serious problems and we're going to be continuously have these problems. Waiting lists are long and demeaning, which in fact generates more problems for people with mental health issues the longer they have to wait to receive mental health care. The Mental Health Commission's annual report also revealed that 84 children were admitted to adult mental health centres in 2018. This is absolutely unacceptable, over 13 years since the Visions of a Change was published. Furthermore, waiting lists for CAMHS in Donegal is at an all-time high, with no sign of this abating due to inadequate staffing levels. Some are waiting more than a year to be assessed, and that's before they get into the system to receive proper care. In fact, we should be at a stage where 24/7 CAMHS is in full effect and fully resourced, yet we are far from that reality. CAMHS, as it is set up now, is not meeting the needs of young people and their families, and has been shockingly underfunded for quite some time. The failure to recruit and retain staff is hampering efforts as well, yet the government doesn't seem to be doing anything to address this crisis. And yet, let's not forget the young people in third-level education. Record numbers of third-level students are receiving counselling for mental health problems, such as anxiety. However, the number of counsellors per student, one for every 2,600 students, is very low compared with the recommended ratio agreed by the International Association of Counselling Services, where they say that there should be one counsellor for every 1,000 to 1,500 students. This means students can often end up waiting for weeks before they have access to a counsellor. Latest figures show waiting times vary from between 7 to 40 working days, depending on individual colleges. Another reason for the dire state of our mental health services in Ireland, I believe, is ideological. And your government does not believe in the right to healthcare in the sense that it should be based on need and not ability to pay. And I think that is the crux of the problem. Instead, you continue to invest in a two-tier health system which consistently undermines our public services. Despite this, the government continues to support this structure as opposed to winding it down, with staff moving away from public care to private care. Concordia took over a decade for Ireland to ratify the UN Convention on the Rights of Persons with Disabilities. I hope it doesn't take another decade to reform our mental health services so that the human rights of all those involved with mental health issues are protected. And Minister, I do believe that you have to talk about it on a human rights basis and on a right to treatment, not cost of treatment. That is the only way that you'll sort this out once and for all. And I would love to see actually it laid before the Dáil here what it would actually cost to have a health service that is fit for purpose, rather than have a health service that meets the arbitrary budgetary figures that are picked for every year for it. And that would be refreshing in itself. Thank you.